Hey everybody, welcome back to the Virtual Health Careers Conference 2021. I'm George. I've spent most of today on the AHP live stage. This is my first time on the big stage in the middle of the conference. Bit about a background from myself. So I'm from the paramedic profession. I've just finished my degree in Liverpool in paramedic science. So I'm currently awaiting registration with the HCPC as a paramedic later on this summer and to start work in that profession. It's my second year with the Health Careers Live team. It's my first time here presenting live, so it's really great and I hope everyone's having a good day. So the next session is going to be from Joe, Enna and Hannah from On the Frontline AHP, who we can see up on the stage. Their organisation is fantastic. They run the podcast which I myself, amongst some of the other ambassadors for Health Careers Live, were lucky enough to be part of a few weeks ago. And it's a really great organisation informing people on careers in the allied health professions. The allied health professions is the third biggest workforce in the NHS, and they're going to give us a bit of a brief overview of AHPs. So I'll hand over to you guys if you're happy.
No, thank you very much. Thanks, George. Thanks for that. So welcome, everybody. Welcome to Health Careers Live, and more importantly, welcome to the Allied Health Professions keynote speech. So as George said, we are from the On the Frontline AHPs team, and we're here today to provide a brief introduction into the allied health professions. So hopefully then you can either join or re-watch the other wonderful talks that have been had today to learn a little bit more about what we do. But in last year's keynote speech at the National Conference in November, Anne and Sarah asked, could you be an AHP? So this year what we wanted to do is inspire you to come and be an AHP. But before we go into a little bit more detail, we'll just introduce ourselves. So as George said, my name is Enna. I'm Enna Ankutse. I'm a pelvic health physiotherapist, and I'm one of the co-creators of On the Frontline AHPs.
So my name is Jo Siddal. I'm a neurological physiotherapist and also co-creator of On the Frontline AHPs.
Hi there, my name's Hannah Rowland. I'm an occupational therapist currently working in the NHS in Wales. And I am an On the Frontline AHP ambassador. That's what I am.
So On the Frontline AHPs was born back in March last year in the form of a Facebook page. At the time, like many other allied health professionals and other healthcare professionals, both Enna and I had been redeployed into the intensive care units to help with the increasing demands of the pandemic. Then more than ever, it became obvious to us that there wasn't really a platform available to share and promote the crucial work that AHPs do during the pandemic, but also before and after it. And all it took was an idea from Enna to myself and a message. And suddenly we had a Facebook page and over 1,000 followers.
Yeah, and since then we've grown a fair bit more than we kind of ever expected, and we've expanded to Twitter and Instagram, and as George quite rightly said, we also have a podcast called AHPs Off the Record. In our podcast, we interview different AHPs at varying stages of their careers to find out how they got there and what they love about their jobs. They give a really good insight into different AHP roles, and some of our podcasts are actually featured today in the virtual booth at today's conference. And some of the guests that have been presenting today on the AHP stage are actually some of the guests from our podcast, so please do check them out.
As well as raising the profile of AHPs, we as a team are passionate about encouraging recruitment into our roles and improving the accessibility of AHP courses to a more kind of diverse and inclusive population. So this is what has brought us here today. So
I think the right place to start is actually just have a little bit of a chat about what are AHPs. So AHP stands for Allied Health Professionals, and allied health professionals are the third largest workforce in the NHS. So AHPs provide system-wide care across health and social care to assess, treat and diagnose and discharge patients across a variety of settings. So we tend to adopt a holistic approach to healthcare. So this enables us to manage patients' care throughout the span of their whole life. So this can be all the way from birth up into palliative care where they could be passing away. And our focus is mainly on prevention and improvement of health and well-being. So we aim to maximise the potential for individuals to live full and active lives within their family circles, their social networks, education, training, and also in their workplace. So there are actually 14 different allied health professions, And we're going to give a little quick synopsis of each profession, but just a note, by no means do these summaries cover all aspects of each of these professions' job roles. There's definitely a lot more research to be done, so please go and do your own research, and actually maybe go back and have a look at the WOW show that was done today, which goes through all the different professions, and have a listen to some of our podcasts, because that will give you a good insight too.
So yeah, we're just going to give a brief overview of all the different professions. So first things first, we'll start with occupational therapy, which is what I do. So as occupational therapists, we help people of all ages overcome the effects of disability caused by illness, aging, or accidents, so that they can carry out everyday tasks or occupations. The main aim of occupational therapy is to work with people to problem solve in order to increase independence, which is lovely. So this could be by physical or practical rehab, equipment provision, education, and many more. Next, we've got orthoptists. So orthoptists are actually experts in diagnosing and treating issues in eye movement and problems with how the eyes work together. They are trained to offer a range of treatments in the management or correction of a variety of conditions. They help patients to manage the visual symptoms of their condition and provide advice for the visual and general rehab of these patients. Thirdly, we've got drama therapists. So drama therapists use active and experimental techniques to provide a space for participants or patients to tell their stories, set goals, solve problems, express feelings, or achieve calm. Drama therapists can work in a variety of patient groups. However, within the NHS, their expertise is usually used working alongside children, mental health patients, and learning disability patients. Within AHPs, you've also got diagnostic radiographers. So their responsibility is kind of taking and overseeing a variety of different scans for patients. So they use special imaging equipment to take pictures of bones and anatomy within the body to help doctors diagnose patients. We've also got therapeutic radiographers. So they deliver radiography for patients undergoing treatment for cancer. The role of the therapeutic radiographer involves managing a patient's treatment of cancer, as well as providing expert advice and support while delivering accurate radiotherapy treatment. And then last for me, and then we'll move on to Joe, is art therapy. So art therapists use art as a way to allow patients to express, address, and communicate how they are feeling and events that they might have experienced. They work with all ages with a wide range of difficulties, disabilities, and illnesses. So if we move on to Jo, she can tell you a little bit more about the other AHPs.
So next up are physiotherapists. So that's what myself and Anna do. So physios help people affected by injury, illness, or disability through movement and exercise, hands-on therapy, education and advice, and treat lots of different systems in the body, including the nerves, the bones and joints, the muscles, heart, and the lungs, which a lot of people don't tend to know. Prosthetists and orthotists use the latest technology to help patients who need prosthetic or artificial limbs, specialist braces, or other types of aids. They have very specialist training in biomechanics, anatomy, and physiology, which helps them to provide a skilled analysis of people moving and create engineering solutions to help them with their difficulties. Paramedics is one that most people have heard of, and it's a profession that crosses healthcare, public health, social care, and public safety, and they provide care in lots of different situations. So I think paramedics are best known for responding to 999 calls, but not all paramedics wear green, and many work in different areas like GP practices, accident and emergency, or police custody suites. Next up is speech and language therapists, who provide life-changing treatment and care for both children and adults who have difficulties with their communication, their eating, their drinking, and also their swallowing. Patients might range from children whose speech is slow to develop to older people who might have lost the ability to eat, drink, or speak when they've been affected by illness or injury. And finally, from me, osteopaths. So these are experts in the body's musculoskeletal system, and they use manual therapy, health advice, and exercise prescription to detect, treat, and prevent health problems. So through their treatment, osteopaths aim to increase joint mobility, relieve muscle tension, enhance the blood and nerve supply to the body, and also help the body to heal. So moving on to Anna.
Okay, so I'm going to do the final four AHP professions. So start off with is dietitians. So dietitians assess, diagnose, and treat dietary and nutritional problems. They use the most up-to-date public health and scientific research on food, health, and disease to treat complex clinical conditions such as diabetes, food allergy and intolerance, irritable bowel syndrome, eating disorders, chronic fatigue, malnutrition, kidney failure, and bowel disorders. They provide practical guidance to enable people to make appropriate lifestyle and food choices. So music therapists. Music therapists use music as a non-threatening tool in their sessions to reinforce or diminish behaviours or achieve individual goals. They use the person's natural musicality to offer appropriate, sensitive, and meaningful music interaction. So music therapists can do individual or group sessions. For a child with autism, for instance, this could be helping them to find a way to communicate with others. For a learning disabled adult, this could be to help them find a way to express their emotions in a safe and supportive environment. Or for an older person with dementia, this could be helping them to feel valued or to feel heard. Next is operating department practitioners, also in short, ODPs. So ODPs provide high standard of care throughout a patient's surgical journey. So they making sure procedures are carried out as safe and effective. They assist the patient before surgery, preparing specialist equipment and drugs. They work alongside the surgeon, providing the correct surgical instruments and materials, and assessing and monitoring a patient following their surgery too. And last, but by no means least, are podiatrists. Podiatrists, also known as chiropodists, are healthcare professionals who have been trained to diagnose and treat abnormal conditions of the feet and lower limbs. They also prevent and correct deformity, keep people mobile and active. They can relieve pain and treat infections. They can also treat and alleviate day-to-day foot problems such as blisters, gout, and sports injuries as well.
So yeah, as you can imagine, with that many kind of professions, we also work in a vast area of settings as well. So just a few of the areas that we work in, I think the main one that people think of is hospital settings. So this includes inpatient wards, outpatient clinics, A&E, operating theatres, and even maternity units as well. But then you've also got the community settings. So this is GP practices, various different clinics, schools, care homes, people's own homes and workplaces, hospices, and then also within the justice service as well. So this could be prisons, police stations, etc.
So you might be wondering, what sort of typical traits would I want or need to have in order to become an allied health professional? So generally AHPs are people who have a real drive to help people and are quite compassionate. People who are keen to inspire change, and that might be with the patients that you're working with to help them improve their quality of life. And it also can be to help improve the services that you're working in and make sure that you're providing the best service to your patients. Generally, AHPs are people who have very strong communication skills and not only communicate well, but also enjoy meeting and talking to lots of different people, because working as an AHP, the number of different people that you meet is amazing. And that sort of links into being able to communicate well and work well within a team, and also just enjoying working with others. You often end up working in a very large multidisciplinary team, and often with other members of the AHP family, which is really lovely. AHPs are generally quite creative people and good at problem solving, so finding innovative or interesting or different ways for their patients to do things, and also different ways to do things within a service. Generally, we're quite flexible. Every day is different as an AHP, so being able to respond to the unexpected and change what you're doing to improve your practice or to help others. Generally, you need to be quite patient. You're going to be dealing with lots of different people and sometimes having some communication difficulties. Tend to be people who display a high level of professionalism and are able to maintain sort of professional standards with their work, and also people who are just inspired to empower other people to lead the best lives that they possibly can.
So you're probably wondering after today, or maybe you're wondering anyway, what's the best kind of way to become an AHP? So there's lots of different pathways, and I think there is a pathway to suit each person's individual kind of like learning style as well. So I think the main one that people are aware of is a degree, so like an undergraduate degree. So this would usually be a Bachelor of Science degree, BSc, and this can be either full-time or part-time, obviously depending on the things that you've got going on as well. Another one of these is an MSc, so this is a master's degree, or a postgrad degree, which you'd have to do if you've, well, you have to do, but you can do if you've done an undergrad before. Another one, which is kind of becoming a bit more popular now, a bit more common, is apprenticeships. So it's a bit more vocational, so you learn by doing and then kind of do the study alongside working within a specific job. A-level courses or BTEC courses, I know health and social care is a popular one. Transferable skills from other professions, so it might be that you've worked somewhere before, kind of person-facing job, and you're thinking, oh, what else could I do with these skills? So if you've worked in the army, kind of within the law services, hospitality services, it's a good way to get those skills. Something called the T-levels are coming this year. I think it's September of this year. So the T-levels are basically an alternative to A-levels, apprenticeships, and other 16 to 19 courses. So it's just another way to kind of gain that vocational experience, really. So if you learn more by doing. And then obviously is a good one is trying to seek out opportunities as registered or skilled support staff. So as an occupational therapy, you might look at becoming an occupational therapy technician or a physiotherapy technician, things like that, just to gain a little bit more experience.
But thanks, Hannah. And we thought, in terms of how best to end the AHP keynote speech, we thought maybe we should share some of our own personal perspectives in terms of what we enjoy specifically about our professions, but also what we enjoy about being an AHP. So Jo, do you want to go first?
Sure. So I think one of the huge things I love about being an AHP is the opportunity to meet so many different people with such a big variety of conditions or presentations. I think you're always learning. There's such a culture amongst AHPs for learning and development throughout your career, and there are so many opportunities. I think I really do learn something every day. Specific to physiotherapy, I love getting hands-on and really being able to help my patients. I think delivering a huge variety of different treatments and really seeing change, which can help you to really make a difference to someone's life, and having the opportunity to not only support a patient through a difficult time, but also their family. How about you, Hannah?
Yeah, so mine's probably quite similar to you, really. Working as an AHP, you're working in such a variety of teams. So depending on what setting you're working in, you're just working in such a variety of teams with such different people. And obviously working alongside the medical team as well, to ensure best outcome for patients. I think it's really nice, no matter what AHP profession you are, is kind of being able to show other professions and also patients what we do, when we're not necessarily as well known maybe as other professions like nurses and doctors, but showing how well we can kind of impact patients. I think this is I feel like this is very relatable to occupational therapy. I'm constantly having to explain what occupational therapy is because it's such a varied profession, and it's so different depending on where you work. So I kind of love being able to show the positive outcomes that we can get kind of for our patients. I also like how practical occupational therapy is, as every task that we as people engage in throughout the day, so maybe this is brushing our teeth, cooking, driving, kind of everything we do is an occupation. So as occupational therapists, we use these activities to engage people, in whether that's in rehab or whether they're having difficulties participating in some sort of task. We use these kind of practical things to increase someone's independence. So I just think, why wouldn't you want to do that?
Yeah, and I think for me, in terms of what I enjoy about being an AHP, is I think although I do feel like we are sometimes the unsung heroes, as we said, we're the third largest workforce in the NHS. I think when people do discover what we can do and how we contribute to during the patient's pathway, I think it's undeniable the effects that we can have and the positive effects that we can have for patients. So I think when we come together as all AHP professions together and working with the other healthcare professions, doctors, nurses together, I think we all fit the puzzle quite nicely to just provide the best care that we can for all of our patients. Specifically as physio, I think the word varied has been chucked around quite a lot, but it's true, it is a very varied profession. But I think most people associate physio with being just about sports. So not that it can't be, it can, but I think I didn't realise until I joined the profession how the different areas that we work in, it's insane how many different areas that we can be in. And I really like that. I really enjoy the fact that it can be so different. Like for instance, I work in the maternity services, so I work with pregnant women and look after them when they're initially had their babies, which I don't think anybody would possibly think that a physiotherapist was involved in. So I quite like the surprise that comes alongside that.
Amazing. So that's all from us for today. Thank you so much for joining and listening. We hope it's been interesting and you've hopefully learnt a bit more about potential career opportunities within health and social care, and hopefully been inspired to learn a bit more about potentially becoming an AHP. Just a massive thank you to Carrie Biddle, the Health Careers Live team and Health Education England for firstly inviting us to speak here and also organising such a spectacular event. We're happy to answer any questions you might have. And as mentioned, to hear more about AHPs, check out the WOW show or check out our podcast, which are on the virtual booth. And you can have a listen to different AHPs talking about how they got there, what they do, and what they love about their jobs. So thank you very much.
Thank you, guys.
Thanks.
Thank you very much, guys. That was fantastic. And it's great to learn more about the allied health professions. I think there's so many varied roles within healthcare, and you could spend forever trying to learn so much more, so it's great to have that insight. I really like what you said, Hannah, about everything being centred towards the best care possible for the patient. Ultimately, all these roles exist, and we continue to learn about these roles, and it's all with that common interest of improving the care that we're able to deliver to the patients. So thank you very much for that. It was fantastic.